Would you define enrollment? Define what you mean by enrollment.
We are giving you the numbers of individuals who have chosen a plan.
But not actually paid their first premium or received
through the end of November, yes. Payment isn't due, as you know, sir, until mid-December in order to be fully covered. So we don't have those numbers, and I think most Americans probably will not pay until their money is owed.
So you can't guarantee the actual number of constituents who have coverage that they...
Not until they pay their premium.
The congressman doing the questions is Joe Pitts, Republican out of Pennsylvania, chair of the House Health Subcommittee. Sir, good morning to you.
Good morning.
What did you learn from that?
Well, I learned that the Secretary is less than forthright. They're losing credibility every day. They wouldn't admit how many cancellations there were. They wouldn't tell us how many were actually enrolled. They won't admit that this is harming the American public. They don't admit their broken promises. So, unfortunately, they're not trustworthy. They're not being candid with information they have.
Why would that be? Well, and let me phrase it a different way. Do you think they have the information, they're just not coming forward with it because it would be embarrassing to the program so far? Or do they possibly just not know, sir?
I think they have a lot more information than they're giving us. That has been the case in the past. And so we're just going to have to wait, and once we get the information, then perhaps call the Secretary back and review what she said last time and try to get more information in the future, because this is a rolling disaster.
If that is the case, what do you think that lack of information reveals, whether publicly or privately?
It reveals that not only was the website broken, this is a broken law. There are a series of problems that are just waiting to happen. The next big one is the gap in coverage. People who think they're covered, who on January 1st, when they go to their doctor, are going to find out they're not covered. And that's going to create real panic. So we're just going to stay...
Let me ask you about that. Do you have a number or an approximation for the number of people who may be a victim of that scenario in January?
No, but I think, you know, it's a huge number. We don't actually know. We know, for instance, that all the state high-risk pools are being canceled, so people with pre-existing conditions will lose their coverage on the state high-risk pools. We know the federal insurance program is going out of existence on the 31st, so there will be probably hundreds of thousands of people with pre-existing conditions who are not covered.
So you're saying hundreds of thousands of Americans next month will find out that they thought they were covered and they're actually not?
That's what I would suggest, yes.
The administration will argue Massachusetts did this, and it took them a year, and eventually they got their wheels underneath their cart. Do you think that could be the case here?
I do think they will get the website fixed and the process fixed so that people can sign up. The problem is a lot of the younger people will choose the fine of $95 rather than premiums going up several thousand. You will see a death spiral occur if that happens, and rates go up next year. You'll see small groups canceling plans. You'll see, you know, many, many more people losing coverage than the 5 million so far. So there are problems coming down the line, not to say anything about the cuts to Medicare Advantage to seniors and other cuts that they have in the system.
Hundreds of thousands.
Yes, sir.
In 2014. Wow, that will be a stunning story if that's true. Joe Pitts, sir, thank you. Republican.